Hi, my name is Molly Fini, and I'm a holistic practitioner. Today I'm going to talk about the yeast syndrome, which is, you can call it candida. You don't have to have candida to have yeast, but it is a ever-growing problem that is affecting everyone all over the world. I'm going to use a few visual aids just because I want you to see some of the lists I have of what this can cause. And if any of you that are watching this or listening to this want a copy of anything that you see today that I show you, feel free to inquire and we can get that email to you, okay? So yeast syndrome, or candida, it's a fungus infestation that's responsible for a vast number of diverse physical, emotional, and mental disorders that we have today. And if you've ever it's just an overall lack of wellness. It's not a disease, but people that just don't feel good, they have digestive issues, they have urinary tract issues, they have bladder infections, they have brain fog. There are so many symptoms that are associated with yeast syndrome or candida that people don't realize it. And then do you ever feel like you go to the doctor and you just don't feel good, and no matter what you do, you just don't feel good? And a lot of doctors think it's in your head, and they're like, oh, it's in your head, you're imagining it, but you're not. It affects your adrenals, it causes fatigue, it causes so many things. It also, if you have it long enough and if it's severe enough, it also, creates autoimmune disorders. So the candida or yeast syndrome is rampant all over industrialized countries. So even though everyone in the world could get it, it's more rampant in like high-tech industrial countries. And the reason for that is because antibiotics are put in food that pigs eat, that cattle eat. And so if you're eating any kind of pork or beef or anything that has been fed antibiotics, you're getting that antibiotic. So that's one way. There's a lot of chemicals in the air, from petroleum, from gases, from all insecticides, herbicides, pesticides, and there's no way for you to filter all that out of your system. So that's another way. Another way is lack of nutrition. So especially westernized countries, eating at fast food, McDonald's, Burger King, all of these fast food restaurants, what happens is the quality is not there. The quality of nutrition is not there. So that also is an open door for candida and yeast growth. Another example would be if you're on medications. Cortisone, anti-inflammatory cortisone medication that we get from the doctor, that causes candida or yeast growth. Also steroids. So there's so many things that are in our environment and our world right now that some of them we can control and some of them we can't. But a lot of this is man-made. And when I get patients in that say, well, I eat really healthy, or I don't take, antibiotics, there's no way that I can have candida or any kind of yeast growth in my body. My answer to them is there are a lot of ways. Not that you are contributing to it like knowingly, but there's a lot of things in the environment, chemicals, things that you're putting in your body that you don't realize. Even though you don't take antibiotics, if you eat any kind of meat that has antibiotics, you're getting that. If you eat wheat, you think that you're eating healthy. Grains, any kind of grains creates candida. Oral contraceptives, that's a big one. That's how a lot of candida starts in young women, is taking oral contraceptives, and then it just mushrooms into all these different kinds of sicknesses and autoimmune disorders. So some of the things that we just talked about, what fosters yeast growth: oral contraceptives, cortisol medication, multiple pregnancies, antibiotics, bread, brewer's yeast, mushrooms, peanuts, refined sugar, basically any kind of junk food. And it's interesting because we're told not to eat white bread, which we shouldn't, but white bread has the least amount of fungus or mold because it's so processed. There's no nutritional value. So it really doesn't get moldy. It's more like grains that people think that they're eating that are healthy. So yeast or candida affects 9 different body systems: the digestive system, the nervous system, cardiovascular, lymphatic, respiratory system, reproductive system, urinary system, endocrine, and musculoskeletal system. Almost all body parts, organs, tissues, and cells are affected by fungus or candida. Can be. Everybody doesn't have it, but most, I would say, a third of the world population has it, and most of those are in industrialized countries or westernized countries, which most of them are in, like, North America. Children can have it, babies can have it. They get it from their mothers, through the vaginal tract. There are so many, like even babies that have a lot of ear infections, a lot of colds, diaper rash. That's a fungus, that's candida, that they're just going to develop more and more illnesses because of that. Candida is an opportunistic organism, and the most common symptoms are, as we talked about, high-tech lifestyles. It causes indigestion, bloating, constipation, fatigue, bladder irritations and infections, migraine headaches, depression, rectal itching. So these are just some of them. I mean, these are the most common, but there's so many more. And so what I was thinking on when I was asked to give this presentation is, it's so complex and there's so much information. I think I wanted to do a part 1, part 2, and part 3. So this morning I just wanted to talk about how widespread candida is, how much it affects our body, all the systems it affects, all the ways that we can get candida. And the good news is yes, there is a cure. Yes, we can get rid of it. You have to be very compliant, and you have to take a lot of things out of your diet that you might be eating, refined sugar, grains. There's a lot of things that cause candida, and just a lifestyle change, but we can't control everything. But there is a cure. We can get rid of it. And sometimes it takes as little as 2 to 3 months. Sometimes it takes up to 3 years. It just depends on how long it's been in your body, how much it's ravished your body, how strong your immune system is, and how compliant that you can be to really get it out of your body and get healthy. So this is part 1. The next time we'll do part 2, and we'll talk more about it. If you have any questions based on what we've covered right now, please feel free to fill out the information below, ask any questions that you might have. And if you're interested in having any of this information emailed to you, please let us know. Thank you so much.